YouTube. So I am sitting down to film my requested C-section video, and this video is going to be for all of the moms-to-be, support people, and then those random people who have no intention of having children and might not even have the necessary womb to have a child, that this pops up into your recommended feed at 4 a.m. Hi, I'm Elizabeth. I am a labor and delivery nurse for about 6 years, as well as a certified childbirth educator, and I am gonna do 10 things your labor nurse wants you to know about your C-section. If you hear anything in the background as far as snoring or general dog noises, that is my pug Zoe. Come here pug. And she is very loud. This is just her breathing. And she snores very loudly. And she smells very bad. But that's my dog. For those who are wondering what the snoring noise was in the last video, it was her. This video and a lot of the other ones that have been requested are a little bit trickier than just my labor and postpartum videos because so much is hospital dependent and doctor dependent. So I do my best to keep things general, but obviously make sure that you are asking your doctor. This video is for entertainment purposes and information purposes. It does not replace the advice of your OB, your midwife, your anesthesiologist. Just like with my postpartum video, I'm going to start at kind of the beginning before your C-section and move all the way through. And this is gonna kind of touch on scheduled as well as unscheduled C-sections. So for a scheduled C-section, you are going to come in whenever they tell you to, and very importantly, you need to have followed their instructions on when you can and cannot eat. They will delay your C-section if you said, oh, I stopped at McDonald's this morning and got breakfast because I was really hungry. Typically, it's nothing after midnight, but obviously follow the instructions of your MD. The reason why we care if you eat something before your C-section: a few different things. So anytime we do surgery, there is the potential to have to go under general anesthesia. And when you go under general anesthesia, they have to intubate you. Now this typically would not happen with a scheduled C-section because often they'll do a block where you're numb from here down as opposed to putting you under general. But if they needed to put you under general and then were to intubate you, you already have a distended abdomen with the baby on board. Add food to that and your chance of throwing up and then choking on it is very high. And people can actually die from aspirating or choking on their own vomit. So that is why they care if you've eaten something. Also, people tend to get pretty nauseated with the anesthesia that they give for the block. And while they're able to kind of treat that as well, you don't want to feel sick and like you're gonna vomit, obviously. And you don't want to be vomiting up food. So that's why they care. Do not eat before you go in. That is very, very important. The second thing is whether you know you're going to have a C-section or you don't know, you know, you come in labor and things progress to where you need a C-section. Before you go in to have your baby, it's nice to have the discussion with your doctor about what their C-section practices look like. Can you have more than one support person in the OR? Typically the answer is no, it's just the one support person. Do they have a clear drape that you can use so that you can visualize your baby being born? Do they let you play music in the OR, in which case you might want to have like a playlist set up for delivery, something that you know will help keep you calm. So just being educated on your own hospital's practices and policies with C-sections, which I think a lot of people kind of forget or don't think about because they're so afraid of having a C-section that they don't properly educate themselves on what might happen if there is a C-section, can be really important. We really strive at my hospital to do skin to skin in the OR, and that can definitely be a part of your birth plan. Making a birth plan or a birth preference, as somebody told me in one of my previous videos that I just loved, about things that you would want to happen if you did have to have a C-section, is important because they are preferences or plans, but sometimes things deviate from the course which we're hoping that they're going to go, right? I'm sure most people aren't hoping for a C-section who end up having to have one for their health and safety or for their baby's health and safety. In the C-section, you probably will have met a lot of people right before, and then you go in, they're wearing hairnets, masks, you might only be able to see their eyes. I have seen in other hospitals where they actually have people's names on their forehead, like on their scrub caps. I love that. I would love to implement that at my hospital. But Your best friend in a C-section, the person who's sitting by the head of your bed, who you're telling, oh, I feel nauseous, oh, I feel this, oh, I feel that, is going to be the anesthesiologist. So anesthesiologist is your BFF. The circulating nurse is going to be kind of assisting the doctor and assisting and putting things in the computer, and will be there with you. You are going to be asking them for questions. They might even be helping you take pictures, telling you what's going on, all that lovely stuff. So it's great if you know their name and just know that they are in charge of you. Let them know if you feel nauseous, if you feel pain, if you feel anything, because they are the one in control of meds in that case. In the actual procedure, the big thing is they're going to numb you. They might be able, if you have an epidural, to bolus that up. If you were in labor, they might use a spinal. You might be put under general. Those are the 3 routes that babies are born with anesthesia in the OR. If you are awake, they want to make sure that you don't feel sharp, but you are going to feel pressure. And there is a lot of pulling. Think about it, the baby being born from the vaginal canal. There's a lot of stretching and pulling and ring of fire stuff, right? So we're pulling the baby from another part of the uterus and out of your body, but they're still pulling and tugging and pressing. And right when the baby's being born, they will press on the top of your uterus to help the doctor pull the baby out. So there's a lot of pressure at that instant, and just kind of think, okay, I got to get through this pressure, I got to get through this, and I'm going to see my baby. Just like a vaginal delivery, there's so much pressure at the end, but you just muscle through it and then you get a baby. Okay, so there should be pressure, you might feel pushing, there should not be pain. If there is pain, you need to let the anesthesiologist know, or the OB know, when they're testing to see if your spinal and everything sat up correctly. You are out of the OR, you are going to go to a PACU type area where you will recover for a few hours. A lot of places in this PACU type area, you still are only allowed to have that one support person with you, but definitely, like I said in my second tip, check with your doctor and see what the policy is at your hospital. In this PACU type area, your nurse is going to be helping you recover, checking the top of your uterus, which will get pretty uncomfortable. Those fundal massages, like I talked about in my postpartum video, are uncomfortable for vaginal deliveries and C-sections alike. And then of course you also have that incision underneath. And then you are going to be working on feeding your baby, breastfeeding if that's your choice, and working on recovery in that way. It's very important because you've had an open abdominal surgery. We're going to be really focusing on making sure that you're warm enough after the surgery, and that all of your vital signs remain stable in that PACU setting. At our hospital, we put people in the PACU for 2 hours and then move them out to their postpartum room, and that is when all of the family can come. With that spinal that I talked about, a spinal is going to be an injection of anesthesia medicine into the spinal space. It is not like an epidural because it goes in, the injection of medication is put in, the needle is taken out. Whereas with an epidural, the needle goes in and a catheter is threaded around the needle and the needle comes out, but the catheter is still there giving medicine. With both of those, often a drug called Duramorph is used. It is a morphine derivative that works really well in controlling pain for 24 hours. With that Duramorph though, a very, very normal side effect is itching. And it might be, oh, my nose is a little bit itchy, or like, oh, I'm a meth addict, there are bugs under my skin itchy. That is not an allergic reaction, but itching goes along often with the C-section, and it can be really annoying where you can't sleep. Definitely let your nurse know postpartum. We have medications to help control the itching, and in my experience, the itching is much better than people who don't get the Duramorph compared to the pain. Just like with my postpartum video, it is okay, especially right after you've had major abdominal surgery, especially if it's, you know, after laboring and laboring and laboring, to say, I don't want visitors. That is okay, and that is, I think, totally valid. Or if you deliver in the middle of the night, say, come back in the morning, we'll see you then. I know everybody's been waiting to see your baby, but they will have the rest of your baby's life to hang out with your baby, and you need to get some sleep and some rest. My next tip is about pain and discomfort. You've had major abdominal surgery, or you're going to have major abdominal surgery, and you are going to be more painful than those who have vaginal deliveries. especially if you have labored and pushed. You're going to be more uncomfortable than if you go in just for a scheduled C-section. If you have a tubal ligation, you're going to be more uncomfortable. And so just kind of keeping those things in mind and making sure that you are taking your pain medicine when it's offered before things get really bad, and that you are getting up and walking and moving. The second day is going to be your most difficult day pain-wise, more than likely, because you're getting up for the first time and moving around, your catheter is out, you're kind of having to function as a normal human being, that Duramorph has fully worn off, and things are uncomfortable. So making sure that you are taking your pain medication when you need it, and maybe even a little bit before, and chatting with your nurse if the pain medication is only ordered as needed about, you know, would you like her to wake you up for pain medicine, how often you'd like to be taking that. Some people do great with alternating ibuprofen and Tylenol, and some people need narcotics. So just figuring out what you need and making sure that you keep that pain level manageable is really important, because once it gets unmanageable, it's more difficult to bring it down to a manageable level. Whereas if you're always kind of keeping it manageable, you're good to go. If you have a cough or you are laughing after your C-section, it can be uncomfortable on that incision. So what you want to do to make things more comfortable with that is brace your incision with a pillow and apply. Right now is allergy season where I am, and we just had cold and flu season, and coughing is totally a thing that happens. So using that pillow to brace before you cough is going to be really, really key in making you feel more comfortable through coughing, and doing your deep breathing and using your incentive spirometer that you need to be using after your C-section. That being said, with getting up that very first time, again, like in my postpartum video, don't get up by yourself. Your nurse should be getting up with you. You might still have a catheter in. It might be out, just depending on when you get up. We typically get up the day of surgery in the evening, so about 12 hours out from surgery, we'll get somebody up to a chair. And a lot of times people are nervous. They're really nervous that their incision's gonna bust open. It is going to feel really, really, really tight on your incision, but it should not open up. And just kind of being aware that that tightness feeling is normal. Another thing that's going to be normal is you probably will have a gush of bleeding, and that's not a hemorrhage or anything like that. That's just gravity working for the first time. You've been lying pretty flat, and when you stand up, gravity is going to work and have a little gush of bleeding. You might get some blood on the floor. You know, those pads are never where we really want them to be, so don't worry about either of those things. Make sure that you're getting up to the chair, getting comfortable. It's really important that next day that you're getting up and walking the halls a few times. It's really important for your incisional healing, for your just like general mental well-being, and then also for your lungs, because if you're sitting stagnant in the bed, you're at a higher risk for developing like pneumonia. Something else that goes along with that pain and getting up and walking, and why that's so important, is gas pain. Gas pain is one of the most uncomfortable parts after having a C-section if you experience it. Gas pain refers up to your shoulders, and that's what people complain about more than anything else. So getting up and walking is going to be key in helping prevent gas pain, and asking for a gas pill, simethicone, or whatever your hospital has can also be helpful. But getting up and walking and making sure that you are able to pass gas is really, really, really important. Going hand in hand with getting up and walking the next day, you're gonna take a shower for the first time. Now, you might have a clear dressing that stays on, or a big gauze dressing that you take off, but once you are washing your incision, you just want to use a mild soap. And the most important thing is, after you get out of the shower, is making sure that your incision is really, really dry. So if you have one of those bellies that kind of hangs over a little bit, as a lot of us do after we've had a baby, lifting up that extra belly and really drying underneath of it is important. And one thing that I think is important, you can almost kind of see from this, I'm talking a lot about my belly that you can't even see because it's under the frame of the camera. take a picture of your incision, because a lot of times women, unless you're like a tall Amazon woman, when you stand in front of a mirror in the bathroom, you're not able to see your incision. And it's important to know what it looked like in case there are changes. You know what to look out for. So just take a picture of your incision, have your significant other take a picture so that you have something kind of in memory to know what it looks like in case there are changes and we're worried about some sort of infection or anything like that. The last thing I want to talk with you guys about is probably the most important, and that is, regardless of how your baby entered the world, whether it was a vaginal delivery or through the sunroof, as I like to say, you are a mother and your birth was valid and so important for your baby and life-changing. And even if it didn't go 100% like you planned, and it's okay to grieve that birth that you did not get, just know how amazing you are, and what you did for your baby to bring them here is just, it's unreal. You grew that baby for 9 months, and then you gave your body over to them and brought them into this world. And you might have stretch marks, you might have a scar, and that's okay, and that your baby is so worth it, and you are just amazing. Thanks so much for watching. Definitely leave in the comments below anything you wish you had known about your C-section before you had it, or any other questions about C-sections. I will do my best to answer. So thank you so much for watching. Bye guys.